here why she came in is because she's got a little bit of fluid. This is called a seroma. You'll see on this side where she's nice and flat. If I poke over here, I'm just pushing on her abdominal wall. Hi, it's Dr. William, and this patient has been nice enough to let us film. She is 2 weeks out from a BBL. She's doing really well. She's healed very nicely, but she has some fluid that we're gonna drain today. She also has fluid in a different location. So that's what I want to really explain to you, is that there are 2 locations where fluid can occur, and they're 2 totally different locations, 2 totally different fluids, and 2 completely different ways of treating them. She is 2 weeks, so she's gonna be starting FiberGuard basically today. And her skin looks pretty good. I mean, 2 weeks out from liposuction, her skin looks pretty smooth and pretty good. But if I start to feel in these areas, I start to feel some lumpiness. And so I don't know if you can really appreciate it on camera, but she has a little bit of lumpiness here. So that is fluid, but that's fluid in the skin and in the remaining fat. So that's a different fluid that I'm going to show you now. This is here why she came in is because she's got a little bit of fluid. This is called a seroma. You'll see on this side where she's nice and flat. If I poke over here, I'm just pushing on her abdominal wall because she really doesn't have very much fat left, just skin, fat, and abdominal wall. Here I go to do that, and instead of me, I do hit her abdominal wall, but before I get there, you see like a little fluid wave. You see that little wave? Kind of like if you poke into a lake or something, you get like a little ripple, and that would set off some waves. So this is a seroma. This is fluid that I'm going to be able to aspirate. I'm going to be able to remove it. If I took this needle and tried to get fluid out of here, I would end up with nothing because the fluid here is not available to me. It's not in the correct spot. The fluid here is in this interstitial space, and that has to go away with lymphatic massage and time. That's why she's going to start the FiberGuard, because we want to get this fluid out of there. We don't want to do compression at this point, because compression is just going to sandwich that fluid there and the inflammation, and it's not going to help the skin. It's going to make skin worse. Whereas when we do FiberGuard, rolling, manual lymphatic drainage massages, self-manual lymphatic massages, that's going to get the fluid out of the interstitial space. Cleaned her off already, but we'll just do a little bit again. And so now we're going to be getting the fluid that I'm able to get, and it's going to be a little pinch. It doesn't really hurt. I was asking her earlier, like all this area feels a little bit different than, for example, her normal sensation of her thigh, because everyone always has some numbness after lipo. It eventually goes away, but at this point everyone has it. So here she is. We see that there's a little fluid. It's very small. But now all I do is I'm going to make it, sorry about this, little pinch here. And so now I'm in this cavity, and if I apply suction, okay, now I don't see anything. So now I got to kind of walk around a little bit and see and get into the right little cavity, because it's a very small amount of fluid actually that she has in here. All right, so here we are. We're in this little pocket. Sometimes it can take a little bit of time to find it, particularly when they're small like this. But this is lymphatic fluid, and so you can see it's really not that much. This is only not even 7 or 8 cc's. But she's very thin, so this is noticeable. And somebody who had a little bit more fat, this may not be noticeable. Okay, so we're in there. I'm just gonna withdraw, and that's it. So this is the fluid. This is lymphatic fluid. You'll see, if you can see against my glove, it's clear. There's a few little things. Those are just some fat. It's a little bit of fat that came out with the needle. But it's clear, except it's got a little tinge of blood to it, and that's normal. This is kind of normal. If this were cloudy, then that would indicate there's an infection here. But now if we look here, now when I push, we don't see that fluid wave, and it's the same as this side. So it's really important to understand the difference in fluids because they get treated differently. The whole reason why you wear a board, right? You wear a board here for compression after surgery. Well, you're trying to get that skin to stick down to the muscle to prevent the accumulation of fluid. You're really just trying to close what we call that dead space. But here, where this is all interstitial fluid, there is no free fluid. You don't want to do the compression. You want to do the opposite. You want to activate the lymphatic system so you can get the fluid out. So here, a seroma, then I get the fluid out because it's accessible to me. I drain it. Here or anywhere else in her abdomen or her back or sides or anything, we get the fluid out with massage or FibroGuard or rolling. Any of these type vibrational plates are also very good.